Hi, everybody. Welcome. I'm Dr. Brian Ardis. This is the Dr. Ardis Show. And the CDC has announced that February's of every single year, this is February of 2024, is arteriosclerosis and heart disease month, awareness month. All right. So, arteriosclerosis is the hardening of your arteries, filling them up with plaque and all kinds of stuff, right? So, in order to stay alive and not have clots and strokes, we're going to educate you on what you need to know about arteriosclerosis and the natural remedies for it, and what are the risks with the drugs. On the opposite side, other side of this podcast, I'm going to give you an arteriosclerosis presentation. And then the last half of the show is going to be me and Clay Clark. I'm going to bring him on to update us on the BRICS nations, what all these countries are doing to try to sabotage the American US dollar. And you don't want to miss this presentation. It's going to be pretty awesome. So stay here. We'll be right back with the presentation on arteriosclerosis. All right, everybody. I'm Dr. Ardis. This entire episode is going to be brought to you by two products of mine at the Dr. Ardis Show. Cardio Flow, which is a supplement with a combined many herbs and amino acids that help to prevent and improve the cardiovascular function and ultimately prevent heart disease. The second product is my Foreign Protein Cleanse, and you're going to find out why. There's multiple ingredients in here that are proven, backed by science, to reverse arteriosclerosis and atherosclerosis. So we're going to get into that here. This is Arteriosclerosis and Heart Disease Awareness Month, part of the CDC. Let's educate you on what you need to know. And then Clay Clark's coming up shortly after I get done with this presentation. All right, let's share the screen and let's get into it. All right, it's Arteriosclerosis and Heart Health Awareness Month 101. All right, let's start with this. This is the American Journal of Preventative Cardiology. You'll see the word lipid treatment and goal attainment characteristics among persons with atherosclerotic cardiovascular disease in the United States. Okay, so this is a summary of how many people are being impacted by arteriosclerosis, atherosclerosis. All right, so here's the highlights. The prevalence of atherosclerotic cardiovascular disease amongst adults in the U.S. is 18.3 million, or 8% of the entire United States adult population. 690,000 adults had an acute coronary syndrome event last year, stroke, heart attack, and over 6 million are at very high risk. All right, this is the American Heart Association's website. They're celebrating 100 years this year. Oh my God, they've sucked at preventing and curing heart disease for 100 years now. What is atherosclerosis? Atherosclerosis and cholesterol. Plaque, fatty deposits build up in your arteries is called atherosclerosis. These deposits are made up of cholesterol, fatty substances, cellular waste products, calcium and fibrin, and clotting material in the blood. Atherosclerosis is a type of arterial sclerosis, hardening of the arteries, vein disease. Arteriosclerosis means hardening of the arteries. Very good. All right, so where plaque develops and the type of artery affected varies with each person, the American Heart Association wants you to know. Plaque may partially or totally block blood flow through large or medium-sized arteries in the heart, brain, pelvis, legs, arms, or kidneys. This can lead to conditions like coronary heart disease, angina, peripheral artery disease, and chronic kidney disease. All right, we're going to keep going. You can see the definitions of those there. I'm going to take you through a little slide-by-slide demonstration of what it means when the American Heart Association or anybody tells you you have atherosclerosis, which is a form of arteriosclerosis, hardening of your arteries, which this is arteriosclerosis month. All right, so you'll see here a demonstration of the heart system and all the arteries and vessels that come from the heart, called arteries and blood vessels, veins. All right, so inside the artery, which is what you're looking at here, that red tube with the intima, which is like the insulating lining, the endothelium is what you would call it. Then you have the media, which is the muscle, the adventitia, which is the outside exterior of the artery wall. Now, as I go through one slide after another, you're going to watch atherosclerosis forming. All right, so first you get a fatty streak develops between the intima and the media, as you can see there in yellow. And then there's an unstable plaque develops with a fatty core and a thin fibrous outer shell, as you can see here. So this is a blood vessel plaquing. Actually, this is an artery, so artery plaquing buildup. Then you get a stable plaque, meaning there's a thick fibrous shell around the plaquing. And then they show you here that plaque can start to rupture. Plaque can sometimes rupture into the bloodstream, as you can see visually. A thrombosis is the clotting of blood, which begins at the site of the plaque that has ruptured. So here you see the plaque rupturing. Then blood will get in there and start to form a clot, supposedly. As the blood clot gets larger, the amount of blood flowing by it is reduced, as you can see, as it's getting kinked. If the blood clot enlarges to completely block the artery, all tissues supplied by that artery begin to die below the blockage. No blood flow can get there. The medical term for a blockage is called occlusion. You've occluded the ability of blood to flow through the artery. All right, what's their favorite thing to prescribe for this? Statin drugs. All right, so let's get into statins. Most commonly reported side effects of statins. Most popular one is Lipitor. Most commonly reported side effects of statins include headaches, belching or excessive gas, constipation, so it slows down your bowel function, leading to increasing your risk of colon cancer. Croaky voice or hoarseness. I have actually dealt with this with many, many patients over my career. Lots of people were put on statins. All of a sudden, they got a creaky, croaky, hoarse voice, and they can't clear it up until they get off the drug. Difficulty sleeping, insomnia now. Thank you, sleep apnea. How many people are on sleep apnea machines and you're on a statin drug? Did you know that cholesterol drugs cause sleep apnea and insomnia? You might want to know that because there was a period of your life where you slept without the machine. Wouldn't it be great to go back to that? All right. Heartburn, indigestion, nausea. Everybody wants more of that. Lower back pain. Everybody wants back pain. Nasal congestion or stuffiness. Everybody wants to feel like they have allergies. Slight muscle pain, sweating. Other side effects such as liver damage are rare. And it is not necessary, they say, to have ongoing liver tests while you're taking a statin once you have had a baseline liver function test completed. All right, here's some statin warning signs. Examples of symptoms that might prompt you to go see your doctor after starting statins: excessive thirst or having to urinate frequently, severe confusion or memory impairment. How many of you are on cholesterol drugs and now you've been diagnosed with dementia? That's a side effect of cholesterol drugs. Unexplained significant joint pain or muscle pain, tenderness or weakness. This is their number one published side effect of all cholesterol drugs. They cause musculoskeletal pain all over the body. And as chiropractors around the world who are just seeing people in pain, first question I always ask every patient of mine, this is for all the chiropractors out there in the world, you need to ask them, what statin are you on and when did it start? Almost every time if they're on it, their pain they're coming to you complaining about started 6 months after they started their statin drug. And the moment you get off of it, within 2 weeks, all your pain disappears. And everybody on earth can stop a statin drug today. You don't have to wait. Unusual fatigue or weakness, loss of appetite, pain in your upper abdomen, dark colored urine or yellowing of your skin or eyes. That's liver failure called jaundice. Statins and muscle pain. I just want you to know, muscle pain is their number one published side effect. Statins do cause muscle pain. Although the prevalence, look at that, varies from 0.3 to 33% of all people. A third of everybody on statin drugs complains about muscle pain. It's a big deal. Just get off of it. Statins and memory loss. Here's the FDA talking about its impact on memory loss. The link between statins and memory loss is controversial. Some large studies have shown no effect and have implied they don't have a threat, and then they say that it even prevents dementia, whereas others found an association between statin use and memory loss and confusion. Well, just so y'all know, it's listed as a side effect, so you know it doesn't. Look at the number 2 bullet point: severe confusion or memory impairment. This is a published known effect of the drug. So if you're struggling with it, let it go. Throw the drug in the trash. Statins, and did you know that cholesterol drugs cause new onset of type 2 diabetes? Did you know that? Taking a statin may increase your blood sugar levels, which can lead to the development of type 2 diabetes. Did you know that? How many of you were put on a cholesterol drug and later diagnosed as a diabetic? A lot of you. People who take a statin are more likely to develop diabetes than people who don't. Wow, do you see that? However, in most cases, experts consider the benefits outweighing the risk. Yeah, because diabetes is way better than high cholesterol. It's better to prevent heart attacks and have your limbs cut off because you can't get blood flow to your legs and arms and hands. It's better to be, have body parts removed and prosthetics given to you because you can't walk anymore. You had legs and body parts cut off because you have diabetes from the drug. But it's better than your heart stopping. Okay. Statins and grapefruit juice. Just so you know, there's an ingredient inside of grapefruit juice that is preventative and a cure for all Ebola and Marburg virus. Just so you know. But they often tell you not to drink grapefruit juice with statin drugs. So all of you who are worried about Marburg and Ebola coming, you might need to get off your statin drugs because every doctor tells you to get off the grapefruit juice. You can't drink it while you're taking it. Now, I want to make this very clear. The very first statement on the screen reads, grapefruit juice increases blood levels of atorvastatin. You know what atorvastatin does? It reverses arteriosclerosis. It's a hormone your body makes. And the more salt you eat, the more atorvastatin your body makes. And that helps to prevent hardening of arteries, which increases your blood pressure. The less salt you take, the lower your atorvastatin. And then you develop hardening of your arteries and blood plaques. Blood clots are plaquing in your arteries. Grapefruit juice increases atorvastatin, meaning it helps to prevent high blood pressure and hardening of your arteries. Here's a drug called Bayer. Guess how many people are taking this for atherosclerosis and arteriosclerosis? All of you. All right, aspirin side effects: ringing in your ears, severe nausea, blood or tarry stools, fever lasting longer than 3 days, upset stomach, heartburn, drowsiness, or mild headache. All right, here's lisinopril. Did you know lisinopril, which is a high blood pressure drug, is made from snake venom? Here's the World Economic Forum telling you these life-saving drugs are made from deadly venom. What drugs are they talking about? Oh, venom as a medicine. Oh, captopril. I want y'all to know something. Captopril is an angiotensin converting enzyme inhibitor, a type of drug used to treat high blood pressure and improve survival and reduce the risk of heart failure after a heart attack. Its main compound is derived from a species of pit viper snake found in Brazil. It's called the Draccus viper. Everybody taking lisinopril or captopril or any drug that ends with pril, you are swallowing snake venom from a snake in Brazil that has been known since 1956 that when you swallow it, it will cause cancer in all tissues in the human body, but it will lower your blood pressure. So dumb. All right, lisinopril side effects listed here include high blood potassium, lightheaded, low blood cell counts. Did y'all know that once you go on lisinopril, your white blood cell count goes down? You can't fight infections anymore. Kidney problems, liver problems, headache, low blood pressure, chest pain. What about Plavix? This is another drug for arteriosclerosis. What are their side effects? You need to call your doctor right away if you have difficulty breathing, hives, swelling of your face, lips, tongues, or throat. Thank God for those kind of side effects. And then it says also call your doctor at once if when you start taking Plavix, you develop nosebleeds, jaundice, fast heartbeats, or shortness of breath, headache, little or no urination, you start having seizures, low blood sugar, signs of a blood clot, which are sudden numbness or weakness, confusion, problems with vision or speech. Notice they're putting you on Plavix, but they're telling you about to call your doctor if you start having symptoms of blood clots. Plavix is supposedly helping you prevent blood clots from being formed. That drug actually causes blood clots. Ask your doctor if more blood clots are right for you. All right, let's look into the natural remedies to arteriosclerosis and heart disease. Magnesium. This is a study, actually, and you'll see the link at the bottom of the screenshot on the screen. Magnesium, title of the article is Magnesium intake is inversely associated with coronary artery calcification. So as you take more magnesium, you don't have calcification of your arteries, which is called arteriosclerosis. So if you don't supplement magnesium, you develop calcified arteries, hardening of your arteries, called arteriosclerosis. This is called the Framingham Heart Study. It's very popular, very well known. What did they conclude? Let's look at the conclusions at the bottom. In community dwelling participants, let's just picture assisted living, nursing home, rehab centers. In community dwelling participants free of cardiovascular disease, self-reported magnesium intake was inversely associated with artery calcification, which may play a contributing role in magnesium's protective associations in stroke and fatal heart disease. Isn't that amazing? 500 milligrams of magnesium every single day everybody needs to take. Here's my Artist Labs of magnesium supplement. You can get it at the drartistshow.com. All right, what about the effect of vitamin D on coronary atherosclerosis? Wow, look at this study. Okay, let's look at what they say. Our results support the cardioprotective effects of vitamin D supplementation and are in line with a large trial of 10,000 patients in which vitamin D deficiency was associated with severe or several cardiovascular related diseases, including high blood pressure, coronary artery disease, cardiomyopathy, enlargement of your heart, and diabetes. Here's our vitamin D3. You should be taking the minimum dose of vitamin D3 if you got heart disease and arteriosclerosis concerns. There's another study. NAFLD and atherosclerosis are prevented by a natural dietary supplement containing curcumin, silymarin, and guggul extract. Chlorogenic acid and inulin in mice fed a high fat diet. Now, atherosclerosis are prevented by, I highlighted guggul, G-U-G-G-U-L, for a reason. You'll see here in a minute. Bromelain ameliorates or destroys atherosclerosis. So if you have atherosclerosis, bromelain by itself helps to reverse it. This has been known since 2022, at least is when this was published, and in the journal Antioxidants in 2023, just last year. All right, so what were their conclusions? Our study reveals a new molecular mechanism underlying the protective effects of bromelain on atherosclerosis. Bromelain is a substance found in pineapple stalk extracts.